You know, the National Cancer Institute projects nearly 227,000 women will be diagnosed with breast cancer this year, and nearly 40,000 will die. These are tough numbers to think about, and Allison Gilbert knows them well. She lost her mother, her aunt, her grandmother, all to breast or ovarian cancer. She's now the author of this book called Parentless Parents, How the Loss of Our Mothers and Fathers Impacts the Way That We Raise Our Children. And Allison joins me now from New York along with her surgeon, Dr. Mark Smith, who performed a preventive mastectomy on Allison this summer. Thanks so much, both of you, for joining us.
Thank you.
Thank you.
Allison, I read the column that you wrote recently. It was quite striking, and I just want to share the opening of it with our audience. It says, I'm not a helicopter parent, and my children would tell you that I don't bake cupcakes for their birthday parties, but I'd readily cut off my breasts for them, and recently I did. Again, it captures your attention. Can you give us a little bit of the story and what you meant by that?
Well, my kids are young. They're 10 and 12, and I want to be around as long as possible for them. And I grew up as an older person, but certainly I feel like I've grown up as an adult without my mom and dad, and I didn't want my kids to have to go through that. I want to be around for the day that they get married, when they graduate, even high school before then. And I felt the writing was on the wall with my family history, and also because I tested positive for what we know as BRCA, the BRCA gene, this mutation in my genetic code that would make me a lot more likely to develop breast cancer in my lifetime, and so I wanted to do something about it.
Yeah, I think about that, what you just mentioned all the time. I have 3 young children myself. It's a very powerful motivator to take care of yourself. And let me mention, Allison, you already know this, but a mutation in that BRCA or breast cancer gene means a woman's chance of developing breast cancer is much higher. And people may not know this, but the same mutations can also lead to ovarian cancer, which is the same sort of disease in different parts of your body. In fact, quickly take a look at the numbers. Patients with BRCA1 or BRCA2 mutations have a 50 to 85% lifetime risk of developing breast cancer and up to a 60% lifetime risk of ovarian cancer, compared, as you can see there, with 13 and 1.7% in the general population. Dr. Smith, we've been reporting on this for a long time. I mean, this is your area of expertise. Who do you say should be tested, and how reliable are the numbers you just heard?
Well, Sanjay, I'm actually a reconstructive surgeon that takes care of a lot of breast cancer patients. So I work with a breast surgeon who often will counsel the patients on whether they are at high risk. But basically, patients have a very strong family history, or certainly if another member of their family tests positive for the gene, they would be considered for genetic testing. In addition, having cancer at a young age or a history of ovarian cancer in the family, those are things that are sort of red flags that someone may be at higher risk to have a genetic predisposition for breast cancer.
Yeah, and this may be just a personal sort of question, and a question that individuals will answer differently, Dr. Smith, but who should consider a bilateral prophylactic mastectomy then? Again, based on the numbers that people will hear.
Well, the NCCN, the National Comprehensive Cancer Network, has guidelines on this type of thing in terms of recommendations. Primarily, they recommend it if you have BRCA mutations to consider it. If your family history is very strong, even if you don't have a BRCA mutation, you might consider it, because we don't necessarily know all the genes that cause breast cancer.
You know, one thing else I want to point out again, our audience may realize this, but the overwhelming majority of women who develop breast cancer don't have a family history of the disease. They are the family history. They become that.
But for me, I feel like my stopwatch has been reset to 0. I feel like life is ahead of me now, and then with my risk now, I think it's only 1% breast cancer risk now, lower than the general population. Now I can work with my diet and with my exercise program and really give myself that fighting chance that what happened to my mom and my aunt and my father, who died of cancer, cancer too, and my grandmother, won't happen to me. I could be around for my kids.
It's a remarkable story, and I love that, hitting the reset button. We should all do that. I think people are really going to enjoy this conversation. Allison Gilbert, Dr. Mark Smith, thanks so much for joining us.
Thank you.
Thank you.